Welcome to Reducing Risk, a series of podcasts from Medical Protection created specifically for clinicians in Aotearoa, New Zealand. Reducing Risk looks at key medicolegal issues in our jurisdiction and provides helpful advice and guidance on how to manage those risks. Today we are bringing you our second podcast in our Wellbeing series, where we're going to discuss professional supervision and the common types of issues that are raised in that forum. My name's Dr. Lucy Gibbard, and I'm here with my colleague Sam King. Both of us are medical legal advisors with Medical Protection Society. Hi, Sam.
Hi, Lucy.
And today we're very lucky to have Dr. Bronwyn Campbell back to talk to us and give us some of her further expertise on professional supervision. So, hello, Bronwyn. Thanks for joining us again.
Thanks, Lucy.
Okay, so last time we talked a little bit about what is discussed in professional supervision and the issues that often arise, but I think now we might go on to think about how that relates to medical legal concerns, because this is a medical legal podcast. And in our experience, a number of complaints are generated by other doctors, and we touched on this at the end of our last podcast. And I guess it's more likely to happen when there's a history of feedback that's not gone well within a community of clinicians, or some other instance of poor communication.
Yeah, the thing about poor communication is that it impacts the team, and that increases risk for patients, doesn't it? And we don't get them all the time, but we do get them where the relationships within a department or within a practice have gotten so bad that the doctors start searching for things to complain about each other. You know, in some cases, sounds terrible, but a doctor will go trawling through another doctor's files to try and find things to raise as an issue. And, you know, it's incredibly destructive, because the reality is none of us get everything right. And so if you want to find a mistake I've made, you will find one very quickly if you look. But that's the issue when we don't get on with our colleagues.
Yes, and when that culture starts with everybody looking for problems rather than trying to help each other, the team members will all feel insecure and start looking over their shoulders, and everybody just becomes more and more unhappy.
That is actually true. And that's when we start reporting each other to council, which, you know, when you get a referral to council about a competence concern, particularly if you've got a whole list of competence, you know, of things you might have done wrong, it's a terrible and very stressful process for any doctor to have to go through. And whilst the council might take an educative approach to competence concerns, it never feels like that. It always feels like it's disciplinary. And this process takes months. So, you know, when we notify somebody to council, I think all of us should consider the fact that what that means for the clinician concerned.
Yeah, and I think even though there are times when that may be an appropriate action to take, actually we should always first think about, could this be addressed at a lower level? Could I talk to the colleague who is struggling or is having issues rather than reporting them? Is there any way that I could help them actually address those issues within our own process? Because when the patient, when those relationships have all deteriorated, you know, the patient outcomes and patient feelings about the service being provided can be strongly influenced by how well that team is getting on. So it actually, you know, people think it's just an interpersonal relationship between the doctors. No, it actually does end up affecting patients. It often reduces the flow of information within the team. It reduces clinicians saying, oh, by the way, have you checked that? You know, it reduces us safety netting for each other. So it's really important that we do think, actually, this is a patient concern. And you're much more likely to get complaints from patients if they get the sense that there's a disagreement within the team. If we're making snide little comments in consultation about what the last doctor did, you know, it generates complaints, and it generates uncertainty and lack of trust in the patients in the system. If the doctors don't trust each other, why should I?
Chris Turner founded Civility Saves Lives in the UK, and he's done a TED talk about the potentially fatal impact of how we treat each other at work. His organisation has published data that shows that when a workmate is rude, more than a third of recipients reduce the quality of their work. 80% of the recipients lose time worrying about the rudeness, and 25% take it out on service users.
That's a very staggering statistics, I think.
I think so too. But even more surprising for me was what happens to the witnesses of rudeness. People who witness rudeness in the workplace, half of them will reduce their willingness to help others in the team. And for 20%, there's a decrease in their performance.
Isn't that interesting? If you witness rudeness, you stop helping each other. It's an interesting human reaction, isn't it? Because you'd have thought you'd actually go and try and help the person who someone was being rude to, but in fact, all it really seems to often do is actually increase the problem
And shut people down.
Yeah.
So clearly it's really important that we try and resolve tensions, resolve disagreements and conflicts. So, Bronwyn, what kind of approach would you suggest when a clinician isn't getting on well with someone else in their workplace?
I think a good first step is curiosity. What is going on for them? Can you expand the narrative that you have about them in your head and wonder if you know the full story? Also, I think it's really important that we don't take comments personally. They probably aren't meant as personal criticism, and the team will all get along better if we don't attribute personal criticism to things that are said.
Yeah, I think if we have a work colleague we don't get on with, we often just try and avoid them. It's like the mother telling a kid just to avoid the classmate who's being mean to them, and so we may say, I'm struggling with my communication with Dr. X. I think the best thing is I'll work on different days, or I won't. You avoid it, don't you?
Yes, but avoidance doesn't work terribly well as a strategy or a repair, because it means being stuck. The problem is still there, it's unresolved, and if it's still unresolved, it's still with us. This isn't good for us personally because it can easily become a pattern, and once we have a number of problems that are still with us, we can find ourselves carrying quite a burden of unnecessary baggage. There's also, for the team, the problem that there's no resolution to what's happened.
Yeah. So I think what we were going to go on to now was have a look at that concept of circles of concern and that whole thing about what can we do, and what should we be trying to do? Because if we're not going to avoid the situation, what can we do?
So the circles of concern and the circles of influence concept is attributed to Stephen Covey, who wrote The 7 Habits of Highly Effective People. We all have circles of concern that can include a vast range of things. The state of the economy, American politics, global warming, the organisation that you work for, the way that people drive their cars, earthquakes, how much the government contributes to health funding, and the things that your colleagues do. The list is obviously different for everyone, but the important thing about it is that there is very little that you can do about these things as they are outside of your influence. They're in your circle of concern, but outside of your influence. There's a smaller circle that's described as a circle of influence, and in here there are our family and relationships, our neighbourhood, our close surroundings. So we can influence the things in this circle with what we can control, but we can't control the outcome. The smallest circle in the centre is the circle of control, and this is the things that we do have control over. So these things are our words, our tone, our posture, what we choose to wear, our food, our exercise. But essentially it's pretty limited. The idea is useful because in some cases it's a good reminder that we don't have nearly as much control as we sometimes imagine. We might be spending a lot of time and emotion on things that we cannot even influence, and it can help us to focus our attention and energy on what we can control.
Yeah, so it's kind of like a big target with, on the outside, all these things that you're worrying about, but you can't do anything about. And then the next one in is these things that maybe you can influence, but you can't actually control them. And then this very little center bullseye, which is that little bit of the things that you can actually control.
I think in terms of relationships, whilst I'd like to control some of the politics in the world right now, in terms of relationships, I think that part of us wants to be able to control what's going on in that relationship and outcomes. And I think it can be a bit of a revelation when you realise, actually, I can't control you, Lucy, and make you do things. I can ask you and encourage you, but I can't make you do it. And that's sometimes not easy. I mean, we tell patients what to do all the time. Get on the bed, do this, do that,
Take that medication.
Yeah, exactly.
Go for that test.
But when it comes to our colleagues, unfortunately, it doesn't work the same way, and that's rather disappointing.
It can be disappointing, but it's kind of, it is true. And you can end up feeling very frustrated if you think, I've asked that colleague so many times not to do X or to do Y, and why hasn't it changed? And then you just get angry. Whereas in fact, if you kind of think about that control issue, is I can't control what that person does. I can try, but I actually have to accept that I can't control it.
Yes, I wonder though, from a perspective of peer-to-peer, when you're talking about if you are the clinical lead, for example, and you have responsibilities, you can't control the people you're supervising or who are under you, but they do need to be doing certain things that you need them to do, right? How does that work, Bronwyn? Because it's not about control. How would you describe that kind of relationship?
I guess that this is something I've not thought a lot about, but you do have influence. So I guess that you can think about the things you can control, the words that you say and how you say them, and how you can best use those things to influence what might be happening in your relationship with that person.
And maybe that's saying, well, I can't change what he does, but I can make sure we've got a really good policy to make sure that everyone knows what we should be doing. And I can audit to make sure we see what's happening. And I can provide the audit feedback. So you actually say, what can I as I'm frustrated with my supervisee who's not doing these things. What can I as a supervisor, what tools have I got that will help maybe influence that person? And that may be writing a practice protocol or auditing or whatever it might be that might help, might influence, but isn't necessarily going to change it. And then accepting that.
I guess that's right. Although, look, if you think about employers, obviously they've got HR processes that can happen, which is a big stick, and hopefully not necessary. But because at the end of the day, if you're the clinical lead or you owner of a practice, you need certain things to happen. And if employees are not doing what you want, then there has to be a consequence. But I guess it's thinking it's not about controlling them. It's about, I don't know.
But it's also, rather than saying time and time again, do that, having that curiosity to think, why aren't they doing that? What is it in the process that's stopping them doing that? How can I help them do that? And what can I put in place to demonstrate what the problem is to hopefully influence them? And then you're right, you will get to a point where you can say, this is not acceptable, this is a HR issue, disciplinary, whatever you want to do. But you'd have hoped before then, because there's always going to be issues with each other. And if we disciplined and got to HR with everybody, the whole place would fall apart. We have to learn to, and what can I tolerate is probably the other thing when you're that person in the middle is this bad enough that actually it's going to ruin this relationship? It means that I can't work. Or what can I tolerate?
Yes, we have to set thresholds, don't we, for I need to do something now. But the rest of it is, I can live with it, it's okay.
And different people have very different tolerance levels.
Yes.
I think another tool that I sometimes talk about is some useful phrases. So within the course of our working lives, we all experience everyday slights or snubs or maybe even insults. And it might be useful for some people to have a little toolbox of responses that you might pull out in different situations. So one of them is asking for more clarification, and we've talked about this already. Can you say more about what you mean by that? How have you come to think that? Restating or paraphrasing what you've heard. I think I heard you saying this. Is that right? Or even acknowledging the feelings that you've identified behind what's being said. It sounds like you're really frustrated or angry or whatever you've noticed.
Yeah, I think sometimes we're good at ignoring that bit, aren't we? It's the elephant in the room and we don't talk about it. But sometimes I think when someone's in full flight, I think if I say to them, you're angry, it's almost like I'm stating the obvious. Do you understand what I mean? So is that, do you think that's always helpful to be able to say that?
No, it's certainly not helpful in every situation. I guess, we need a range of tools for different purposes, but I guess I hear about situations where there is repeated insults being slung, and sometimes it's just ignored and people carry on, but this becomes then a pattern of behaviour, and at some point something does need to be said, otherwise it just escalates, really.
For those throwaway comments, I agree. Because, and often if you ask the person, they'll go, I was just kidding. But, it's...
But you can say, if you say, oh, well, but it didn't make me feel good. So you can actually say, I didn't feel good about it. And I think the other thing with that, when people say, do we tell people when they're angry that they're angry? My experience often is when people are angry and I say, you appear to be really angry. They say, I'm not angry. It's actually, they deny anger, but it actually gives them a little pause to think, I'm coming... if they have got enough self-reflection to do it, to think, I'm actually coming across as angry here. Is that what I'm intending? Am I intending to come across as angry? And if they say, I'm not angry, say, oh, well, I'm sorry, that's how I perceive that communication. Maybe there's another way we could approach this. So maybe it's just a pause thing. And because I think people, when you say you're angry, they often say, no, I'm not.
Yeah. So perhaps anger is not a great example, but there are slights and insults that people experience at work. And one of the tools that I used when I had teenagers who were occasionally horrible, I would sometimes just, in response to something awful being said, just say, ouch. So I was indicating that this was hurtful, but I'm not going to get into it right now, but I'm not going to let it go either.
I have to say, I was telling Sam I had a patient who got very angry with me about wanting to start a new problem 25 minutes into a consultation, and he let rip. And I was so shocked. I said, goodness, that was rude. That was my instant reaction, was like, goodness, it was rude. And that really stopped him in his tracks. It was like, because I was so shocked at it. I thought, but actually it worked really well. It was very effective, just actually pointing out that he was being very rude.
Another thing that I've done is when people have said what they've said in not a particularly nice way, I will leave time and I'll go, okay, like, okay, and then we'll move on. So I'm not going to respond to that, but okay, I've heard you. Yeah. Maybe it is. It's just giving people room to pause, because that's often enough.
One of the other things that we sometimes talk about in professional supervision is knowing your why. So why are you doing this? What do you value about your participation in this work? What are you constantly drawn to, and what makes you come alive? What are you good at?
Yeah, that's that Simon Sinek approach, isn't it? I've listened to his podcast. It's called A Bit of Optimism. Do you listen to that, Ron?
Yes.
It's really good. But it points out that actually, generally things go better in our work life if we value what we're doing, and also, what your team members do, and that it's easy to think, so-and-so isn't doing the right thing, or somebody's doing it differently. But we probably all bring different things to our workplace, don't we? And we have to value each other, even if what they're bringing isn't necessarily what we think they should be.
I think if you know your why as to why you are going to work, it's really helpful to prevent burnout. And I mean, there's been studies on that. So I think it's an important thing for us to remind ourselves, because look, in every job, there are going to be difficulties. There are going to be stressful points and people that perhaps drive you a bit crazy. But knowing why you're there makes all the difference in the world, doesn't it? So it's looking beyond the immediate chaos and looking at the bigger picture. That takes time. It means drawing aside and spending and being able to reflect and think, why am I there? It's so terrible. Why don't I leave? Well, actually, I don't want to leave because of A, B, C, and D.
Mm.
I often think it's one of the other things is that you don't often, I'm thinking in general practice particularly now, you're one-on-one with a patient a lot of the time. It's a very long-term relationship, and it's stressful, and there's a lot to do, and not everyone says thank you all the time, and you're often really going out of your way and using a lot of your own free time to try and make the path of our patients smoother. I don't think there's a GP in the country who isn't spending their evenings trying to write back for us the third referral to try and get that patient in to outpatients or whatever it might be we're doing. And the patient hardly even knows that you're doing, or you think the patient hardly even knows you're doing it. But I have to say, I retired from my registered practice. I'm still working, but not with my own registered practice now. And when I left, all of a sudden you got all these letters and cards, and actually everyone does. They do appreciate you. They're not saying it, but actually your patients, and it is a huge value to what we do. Is what we do for our patients, and it's easy not to notice it, or not to reflect on it, or not to think it's there. And it's sad that you have to, it's only when you leave that actually you realise how much it actually means to people. So, and what value that brings to us in our job.
We go to work to help people, don't we? We go to work to make other people's lives better, easier. And that's part of the reward of that. And I think part of the difficulty, particularly when the pressure's on, which it is for just about everybody these days, that you can forget all of that. And so when you get that complaint from an ungrateful patient, probably a person you've bent over backwards to try and help, it can fill your world. It can feel like everybody's like this. No, it's a thankless job and all of those things. But I think reminding ourselves and focusing on the compliments we get, the fact that, people have been seeing you for the last 30 years because they think you're a fantastic doctor. It's all of those things. And often when I'm talking to members who've had a complaint, I try to remind them of that. This is just one small complaint. How long have you been working? How many patients have you seen in that time? I bet there are thousands who really appreciate what you've done for them. And but I think, being the perfectionist that most of us are, we focus on that little 0.01% that we didn't get right. I think sometimes we need to just shift our focus.
But also, I think it also makes you think about that whole thing about interactions with colleagues and how protective that is when we are under stress, and that how we have to value our colleagues and not, when we're under stress, we tend to be critical. We look for things that are wrong around us that we can get angry with, because we're feeling angry. So you find a focus for it, don't you? But that actually our colleagues are the most protective thing we have around us, and we have to value them too, don't we? And have to learn to
you can get through an awful lot if you're with the right people.
Knowing that the people around you have your back, I think, is hugely important.
Yeah, and how you get that in a system that's under stress, particularly if you haven't got a lot of time socialising together. I have to say, I think it's one of the things that medicine has changed over the last 30 years, that I think when in the olden days we used to do call, where you worked during the day and then you did call through the night, and we all slept in the hospital because we were on call, but it meant you spent a lot of time together and then you socialised together a lot, and I suspect in the junior doctors they probably still socialise together all the time, but I think there's a less of a cohesion of socialising with colleagues. And I actually think social interaction, doing things as a team out of work, is
so important.
Is so important. Getting to know your colleagues as people is so important. It's something that we probably it's invisible.
It's harder to get grumpy with somebody you've just been out to dinner with and had a great night. It's way easier to say, hey, look, I don't know what to do here. Can you give me a hand? If you know them and they know who you are, it makes such a difference. So, yeah, even though it's busy and pressured, for practices or departments in the hospital, to make that a priority, to do something. It doesn't have to be much. It could just be, let's all go down and have coffee together.
But some practices, actually say none of us are going to book a patient at 10:30. We are going to have morning tea together. Now, I can't imagine running on time enough to actually do that. But I actually think it would be a great thing for actually saying, we're not booking that slot. We're actually going to go and sit down and have coffee together. And
they do that at my practice.
Do they?
Yeah, they do it. I don't.
Yeah, well, that's
because it's like I just book but I'm not there very often, so I feel I have a responsibility to fill the time and be value for my employer. But yeah, that's exactly what the practice do. They book it. Everyone's in the tea room making a racket.
And do you think that makes the intercollegial relationships better?
It's really good to do that. Yeah. Even just honestly saying hello to everybody in the morning by name. And, that's part of civility, isn't it? That just saying somebody's name, smiling, making eye contact. There's been some interesting studies about, I'm just trying to remember it now. It was in a flash fancy hotel. And what the management said to them was, when you get within 10 feet of a customer, you give you smile or you give eye contact. And then when you're in 5 feet of them, you say hello or something like that and you smile. And that's all they did. That was the intervention. And when they surveyed the customers, their ratings went much higher just with that. Eye contact, a smile and a hello. Doesn't cost you anything to smile, doesn't cost you anything to say hello.
Yeah.
And it's very connecting.
It is, isn't it? Mm-hmm. It is.
So, Bronwyn, I wonder if you have some final words to say about the value of professional supervision and maybe a bit about how clinicians access that kind of service. I think a lot of people out there will kind of think, that sounds good, but what do we do? How do we get there?
Yes. I guess I should start by saying I don't think professional supervision is for everybody. I think some people are just not that reflective, and this is not how they want to spend an hour every now and then.
Right.
But for those people who are feeling burnt out or perhaps isolated or are ruminating over something that's happening, I think it can be really useful. I find personally it's really useful for just getting clarity about some of the issues that I'm coming up against. How to access it. In Waikato, the faculty of the college will fund supervision for up to 5 sessions a year for all doctors in the Waikato who are working in primary care.
Wow.
And in the hospitals, SMOs can claim for professional supervision as part of their CME.
So thank you, Bronwyn, very much for sharing your wisdom with us. And thank you also to our listeners for listening today. If you enjoyed our podcast, please subscribe and like them. If you have any suggestions for other podcasts or helpful feedback, please email us at nzpodcasts@medicalprotection.org.